Okay. And this is going to be for both of you. Julian, you can go first. So intermittent fasting's gaining popularity. How does that fit into the plant-based lifestyle, if at all, according to your research?
Well, I do incorporate time restricted eating with my especially weight loss protocol, but it's more for, well, there's all so many benefits. And it's not, you don't have to conflate plant-based diets with intermittent fasting because basically one is like the timing of eating and then one is the context and quantity of what you're the quality of what you're eating, the food that you're eating. So you could do it in any kind of dietary pattern that you prefer. Obviously, I recommend the whole food plant-based diet as well in conjunction because you're getting the best of both worlds. So we know that if you're eating in a time restricted period of time, you're getting all this time in the fasted state. It looks like it can emulate the benefits of longer term fasting, water fasting, without, disrupting your life. So it's got extraordinary health span advantages. It doesn't necessarily, shockingly, it doesn't necessarily have weight loss advantages metabolically speaking, because it really ends up being like an energy type of thing. But what I've noticed and why I incorporate it with my clients for weight loss is because it's a behavioral advantage. If you're eating, I actually have my clients eat 2 or 3 meals a day. Every time you eat, it's a meal instead of even doing the window. And because of that, they're able to, eat less, mitigate hunger, and then you get all the health advantages long term of having time in the fasted state, because that's the time when your body is able to do all of the other metabolic housekeeping that it needs to do, which gets bombarded when you start eating. As soon as you swallow, you are kicking off this cascade of metabolism, digestion, absorption that's very, very labor intensive, and it shunts a lot of the energy and blood flow to the GI tract. So if you mitigate that, you take time off of that and you give yourself time in the fasted state, your body's able to do all sorts of other important things. And then it's just in terms of weight loss specifically, because that's what I do a lot of, it really does help with the behavioral patterns and hunger mechanisms associated with, losing weight in an easy way, sustainable way.
Any thoughts on this? And also, talk about weight loss, and a lot of your clients are weight loss clients. Ozempic has come on the scene, and that type of medication. Are you seeing, what are your thoughts on that as far as it being effective in the short term, it being effective in the long term? What are the downsides to that? My understanding is it can cause long-term issues with dumping of the stomach contents. So what are your thoughts on that? And then I'll get that from you too, Dr. Pai.
I appreciate this question a lot because I'm always like, you always want to kind of err on the side of non-pharmaceutical therapy. And having worked with I've worked with thousands of people over 20 years now, and the behavioral component is really real and a lot of people really struggle. So what I do with my clients before these medications is I teach you how to eat, when to eat, so that you're not hungry all the time, and to reduce the food noise. So that's what we could do strategically, but some people can't get there. And I think that these medications, as much as I'm not pro medication, have been so efficacious and the safety looks really good. I think that it has it's been on the market for 20 years and the safety seems pretty good. But here's where when I'm working with people that are on them or transitioning off of them, it's an opportunity. So if you really can't get rid of the food noise and you really can't give yourself that barrier of change, that time where it takes to kind of change your habits, really solidify those habits, and this will help you and it helps them, you have this opportunity to maximize your habits right then. Because if you're not as hungry, right, because it decreases hunger, it decreases food noise. So you could take advantage of this opportunity and establish those habits that I would have you establish without the medicine or with the medicine. That will be sustainable. The problem, and this is what I'm seeing with the clients coming to me after going through this, is that they're not changing their diet and the doctors don't know how to tell their clients what to eat or their patients to eat while they're on the medications. And so they're going to gain the weight back when they come off the medication. So that's a big problem. It's definitely, we know that that's a fact. But the other thing, what I work with my clients is, if you're eating less, because you have to eat less to lose weight, there's no way around it. You have to create a deficit in order to lose weight. There's no way around it. It could be keto, it could be Twinkies, it could be anything. You just have to eat fewer calories overall. So if you could reduce your calories, you're going to have less real estate on your plate. So what you eat matters even more. So instead of saying, oh, eat 500 grams of protein, believe me, you can't imagine how much protein the doctors are saying that that's all that matters. But you're on these medications, you're eating less. So make sure you're getting your weight in pounds or more in protein. But what matters more is every bite counts more because you're eating less. So you could use these medications really strategically and teach yourself these new habits that when you are eating, because you're eating less, you eat healthy, you eat, you know, more like you optimize when you eat, and you're learning your body and you're learning your signals without all the food noise, then I see people, I'm helping people transition off these medications. But if you just go in it and you just like, oh, this is great, I'm just not hungry, so I'm eating less of my cheeseburger and I'm having less bacon and eggs because you're trying to get all the protein or whatever people are, the doctors are telling them, then you're not going to have long-term success. There's no way that you could, that's a diet mentality. That's what I try to break with my clients with that's why I say lose weight for the last time. The diet mentality is you're on this path, you're losing weight for some reason, either you're, you know, the bariatric surgery, you're shrinking your stomach, which you could grow back. You're on these medications, so you're shrinking your appetite, it'll come back. But if you learn how to eat, and you learn how to eat healthy, and you learn how to eat for maintenance of weight loss, you can get off the medications and establish lifelong habits. The problem is that the doctors aren't really pushing that yet. So that's kind of what I've been specializing in, is how do I help people optimize these medications if they're on them and they need them, because it could really, really help people get past that hump. And if they take advantage of it, it could be an amazing thing.
Great. Thank you. And Dr. Pai, your thoughts on Ozempic and those
So let
types
me
of
start off with the first question that you asked that
Sure.
I forgot to ask,
The fasting?
which was the fasting. So what we see is this, you know, is there benefits for intermittent fasting? Sure. Really what you want to look at is that why people feel so good about that in general. You know, now not talking about what Julieanna is doing with, you know, once you get to the dietary and look, you know, the sociology, psychology of, you know, of getting better healthy eating habits. But we're looking at why people feel good overall. It's just because they're not putting pro-inflammatory foods in their diet, in their body. And so when they have that rest, they're just in the anti-inflammatory state. But actually, when you start looking at once you find those triggers, right, even on a plant-based diet, like then actually the need of fasting is eliminated. Because what we do is like when we test for patients' nutrition, then we actually can look at like what foods do you need to eat more of? Because everybody wants to go like healthy. So I got people who come in and they'll say if they are plant-based and they're juicing and they're doing all sorts of things, you know, like they're you know getting the full rainbow colored foods, which we should be getting, right? You know, 50, 60 grams of protein, 35 grams of fiber. Great, great, great. But everybody's microbiome is different. Everybody's, you know, assimilation, excretion, absorption is different. So when we start testing for those, and then we can then tell them what to eat more of, and really start to individualize their responses, then the need for things like intermittent fasting is no longer needed. Now it's a great kind of like hold down, I think, like, you know, as a step to like when people say, I need to control this behavior, I need to, that's great. But at the end of the day, you know, when you know, even if you talk to like Dr. Clapper, you know, one of the big guys in you know, for doing fasting for the longest and having clinics with, you know, tens of thousands of patients. Now it's like, well, do we need to do that? Well, not necessarily. It's a big jump start. So for a lot of people, it's like getting them to kind of, you know, calm the body down, calm the inflammation down. But we like to look at is just find the triggers, you know, get the nutrition optimized, individualized. Then it may not have to be as difficult. Now, if people can incorporate it, there's no harm in that. But I think right now it is a big trend. It's a very popular thing. And so, you know, for those people who can utilize it correctly, I'm all for that. Is it sustainable for most people? Maybe not, because of their lifestyle or their job or their family and this and that. So I would use it kind of like in specific instances. But the idea is that when I look at most people who are, again, who are the healthiest people around the world, they're not doing intermittent fasting. It is a way to get there. So I use it, you know, it can be used as a tool, but as it like, do I need to do this forever? It's like, no, if you ate the right diet and you maximize your nutrients and by evaluation and then again fine tuning, then things like you know, again, 5 years from now it'll be a different discussion. This will be kind of past us, and everybody will be onto something quite different. When we talk about Ozempic,